Hello, my name is Annalisa Manca. I'm an integrative psychotherapist, and my goal is to help people like you eliminate or greatly reduce chronic pain without relying on medications or physical therapies. In my work, I guide people on a healing journey using a holistic approach that incorporates mind body practices, emotional awareness, and neuroscience. Today, I'm going to explain a concept called neuroplastic pain and how we can address it through simple yet powerful methods. If you're living with chronic pain that doesn't seem to have a clear physical cause, this video might offer some important insights into why your pain persists and how you can begin to break free from it. To start, let's break down what neuroplastic pain is. Neuroplasticity refers to the brain's ability to change and adapt in response to experiences and learning. When we experience pain, especially chronic pain, the brain can learn to interpret certain physical sensations as pain, even when there is no ongoing injury or damage to the body. In neuroplastic pain, the pain persists because the brain continues to signal pain even after the original injury or source of pain has healed. It's not a physical injury anymore, it's a rewiring in the brain that continues to trigger the sensation of pain. The good news is that because neuroplasticity means the brain can change, we can also retrain it to stop interpreting those signals as pain. In this video, I'll explain how that's possible using methods grounded in neuroscience. Neuroplastic pain often begins with a physical injury, stress, or trauma. Imagine you've had an injury, like in a car accident, or you have experienced a high level of emotional stress, or perhaps a past traumatic event. Your body responds to these events with pain, often as a protective mechanism. But here is where things get tricky. When pain continues long after the original source of it has healed, it's likely because the brain has learned to keep sending pain signals, even in the absence of physical harm. Sometimes this is linked to emotions, past experiences, or ongoing stress that keeps the pain cycle going. It's like your brain has developed a pattern where it associates certain signals in your body with pain, even though your body is no longer injured. This process is driven by the brain's plasticity, meaning the pain pathways can become deeply ingrained over time. While this might sound concerning, the amazing thing is that neuroplastic pain can be treated. We can retrain the brain to stop signaling pain, and there are methods grounded in neuroscience that help with this process. These methods focus on rewiring the brain and addressing emotional and psychological factors that contribute to pain. For example, in my work, we use approaches like emotional awareness, expression, and somatic techniques that help release unresolved emotions, stress, and trauma from the body and mind. Additionally, we focus on retraining the brain to interpret sensations in the body as safe instead of as pain. These methods are based on neuroscience and how the brain processes pain, and they allow us to create new, healthier patterns that support a pain-free life. Dr. Howard Schubiner, pioneer in understanding neuroplastic pain, has outlined key criteria that can help determine whether your pain might be neuroplastic. Let's explore these criteria, which are grouped into three signs that often point to neuroplastic pain. The first is that the pain doesn't behave like structural pain. There is inconsistency, for example. Neuroplastic pain often changes day to day, with no clear physical reason why it feels better or worse. Structural pain, in contrast, is more consistent. The pain migrates. If your pain moves around, shifting from one area of the body to another, it's likely neuroplastic, as structural pain typically stays in one location. If the pain is triggered by non-physical factors, for example, weather, certain activities, times of the day, this may suggest a conditioned response created by the brain. Delayed onset. If pain shows up hours after an activity rather than during it, it's often neuroplastic, as structural pain is typically immediate. And lack of physical diagnosis. If tests and scans fail to identify a clear structural cause or treatments haven't worked, it might be time to consider a brain-based cause. The second sign is that the pain is connected to emotional states. For example, stressful life events. Pain that begins during a stressful time or major life transition often points to neuroplastic causes. Stress puts the brain on high alert, which can amplify pain. Emotion-driven flare-ups. So if pain worsens with stress, emotional difficulty, or unresolved trauma, and eases when you are calm or safe, it's likely neuroplastic. Perfectionism and people pleasing. High-intensity living patterns like constant worrying, self-criticism, perfectionism can put the brain in a state of chronic danger, increasing the likelihood of neuroplastic pain. The third sign is that there is past trauma or nervous system dysregulation. For example, childhood adversity. Experiences like neglect, trauma, or bullying can leave a lasting sense of unsafety in the brain, increasing the risk of neuroplastic pain later in life. Trauma history, that means that survivors of trauma, including physical, sexual, or emotional abuse, often develop chronic pain due to a dysregulated nervous system. Fight, flight, freeze states, being stuck in a chronic state of fight or flight, shutdown due to stress or trauma can trigger neuroplastic pain. Common signs include fatigue, anxiety, dissociation, or even insomnia. And fear of the body. Viewing your body as broken or fragile can increase fear and avoidance, amplifying neuroplastic pain. The brain sees this fear as danger, creating more pain signals. If these signs resonate with your experience, your pain may be neuroplastic. And that's good news, actually. It means the brain can unlearn these patterns and stop producing unnecessary pain. Understanding these signs is the first step to breaking the cycle and reclaiming your life. Once we identify that your pain may be neuroplastic, the next step is to retrain your brain. This involves working with your mind-body connection and addressing the emotional, psychological, and neurological factors contributing to pain. We use methods that focus on emotional expression, somatic tracking, mindfulness practices, techniques that help you break free from the cycle of pain by rewiring the brain's response to it. This process, of course, requires time, patience, and a commitment to yourself. It's about unlearning old patterns and learning to respond to sensations in the body in a new, more supportive way. And as you progress, you notice that the pain starts to decrease or disappear entirely, as the brain's painful pathways are replaced with new, healthier ones. Yes, absolutely. It's entirely possible to heal from neuroplastic pain. By working through the emotional and psychological roots of your pain, along with using techniques that retrain the brain, you can achieve lasting relief. This process is not about masking the pain with medication or physical therapy. It's about addressing the deeper causes of your pain and healing from within. With the right tools and support, of course, also dedication, you can regain control of your body and live pain free. Healing is not only possible, it's within your reach. So, thank you for taking the time to learn more about neuroplastic pain and how it can be treated. If any of these resonates with you, know that healing is possible. You don't have to face this journey alone. Together, we can break the pain cycle and create the life you deserve, one free of chronic pain. If you're ready to begin your journey out of chronic pain, reach out to me to book a free initial consultation. During this consultation, we can talk about your pain, and I'll be delighted to explain my treatment approach to you. I look forward to helping you start your healing process.